All right, so you're here for a hand exam. Okay, go ahead and take a seat right here. You can put your elbows on the table here and then rest your forearms. That's it, just on the supports. Perfect. And kind of flop your hands out towards me. Okay, good. I'm going to disinfect them if that's okay, just with some spray here. Okay, good. Yeah, you can rub that in for a moment. Okay, so let me see. I'm just going to pick up your hands and just relax. I'm going to start with an initial inspection of your hands, and I will tell you if I need you to do anything. Okay. Good. Okay. So, are you experiencing any pain or discomfort anywhere on your hands? Okay. What about any stiffness or swelling in your fingers at all? Okay. Any joint pain or anything? Okay. Alright. And have you had any hand or wrist injuries? Okay. Just holding your wrists here. Okay. And what do you do for work? Do you require to do any sort of repetitive tasks or hand movements or anything like that? Okay. And in terms of hobbies or sports or activities, do you do anything that might impact your hand health? Okay, good. Yeah, I'd just like to know. Okay, you can rest them down. I'm just going to inspect the skin with a light. Okay. Have you noticed any changes in the condition of your skin on your hands? Any redness, dryness? Yes, with the change in seasons, sometimes the skin can get a little bit dry and irritated. Do you use lotion regularly? Okay, that's good. Can you spread your fingers a little bit? I just want to check the skin in between. Okay. Good. Okay. Can you flip your palms up for me? Take a look. Okay, I'm not seeing any discoloration, bruising, redness, lumps, bumps, anything like that. Can you hold your hands up for me? Just a little bit easier for me to see. Okay. Good, you can relax them. I'm just going to palpate a little bit. You could just keep your hands relaxed for me. Any pain? Okay, good. And if I just take this hand and press right here, does that hurt? Feels okay? What about right here? Okay. And right here? And here? Feels okay? Okay, and the other hand. Is that okay? Okay, just let me know if there's any pain as I touch around. Okay, good. Temperature of the skin feels normal, not too warm, not too cold. Fingers don't look blue or purple or anything. And you're feeling okay today? Okay, good. Perfect. Just palpating. Just palpate each of your fingers here. Any pain? Okay. Good. Okay. Perfect. I'm just gonna put on some gloves. I should have done that from the start, but I'm just going to check under your fingernails. So I'm just going to use a light here. If you could just hold your hands up again and just kind of put the backs towards me so I can inspect your fingernails. Okay, good. Looks fine on this finger. This is a little bit uncomfortable. Just want to see. Okay, can you put your hands down? Okay. Closer with the light. Okay. That's good. Looks fine. Let me go ahead and test your capillary refill. So I'm just going to gently press on each of your fingers. Can you hold your hands out like this? Good. Okay. Start with this finger. Within 2 seconds. Okay. That looks fine. Now, I just want to take some measurements of your hands. Okay, so again, just rest them on the supports there. Perfect. A little measuring tape here. Okay, so let's firstly just go across your hand, across your right hand, okay, across the left hand. Okay, I want to do each of your fingers. Just see here. Okay, just checking to see if your fingers are proportionate to the average size. to your age and gender, which they are. So that looks good. Okay. Can you flip your hands over? Just do your palms here. Okay. Looks good as well. And I'm just gonna do your wrists. Okay, just keep your hands still. Okay. Looks good. Check. Can you put your palms together for me? Perfect. A little bit up your arm. Okay. Good. Okay, that all looks fine. Now, can you just hold your palms out like this? Can you wiggle your fingers? Just copy my motions. Okay, can you wiggle just your pointer fingers? And your thumbs? And your pinkies? Yeah, it's kind of hard. Okay, can you just go like this? Okay, can you bend your fingers like this? Can you make a fist really tight? Just gonna feel your hands. Any pain when you do that? Okay. Can you grab a hold of my hands and squeeze as tight as you can? It's okay, you won't hurt me. Good? Is that as tight as you can do it? Okay. Perfect. Relax. And can you touch your fingers to your thumb? Like this. Can you do it with each finger? Yeah. Any pain with that? With any of your fingers? No? It's okay? Okay. Can you put your palms together like this? Good, and I'm going to try and pry them apart, so let me. Perfect, and now keep your hands steady like this and don't let me push them. Good. Good, good, good. Good. Can you put your fists like this and don't let me push your arms towards me? Don't let me. Good, and the other way. Good, just testing your strength. Okay, can you bend your hand like this and then just try to resist my force? The other way. Good, and the other hand, resist. The other way. Perfect. Now just hold your hands like this. I'm just going to gently bend each of your fingers and just tell me when it reaches the point where it starts to feel a little uncomfortable. Okay, it shouldn't hurt, but I'm just gonna start with this finger. Yep, okay. 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 Good. 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 Okay, perfect. Any pain anywhere as we do that? No? Okay. Now if you just rest your hand into my hand, I'm just going to roll your wrist around like this. How does that feel? Okay. Just checking to see if there's any kind of clicking, which there is not. Let's try this hand. And no clicking here either. Good. Can you roll your wrists around? Perfect. Okay. Now, if you close your eyes, good. I have an object that has a dull side and then a pointy side. I'm just going to gently poke your palms and the backs of your hands and your fingers. Just tell me if you feel dull or sharp, okay? Good. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Very good. Okay. Keep your eyes closed. I have a brush now. I'm just going to very lightly brush your hands and your fingers. Just tell me when you feel the sensation, okay? Good. Yes. 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 Good. Yes. Good. 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 Okay, very good. You can open your eyes for a moment. I'm just going to gently scrape around near your fingernails, okay? This shouldn't be too painful, but I just want to have a better look at the condition of your skin, especially around your fingernails because your hands are looking a little bit dry, so I just want to make sure that you don't have any skin conditions or infections underneath the fingernails. So just hold still and let me know if this is uncomfortable, okay? Everything looks pretty good, nothing out of the ordinary. I'm just going to collect some samples here, however, just of the skin that's kind of like flaking off here just a little bit. So that I can just send it off to be tested. Okay. There we go. Just kind of put that to the side on this pad here. Okay. Can you close your eyes once again? Good. And just tell me which finger I am pressing on, okay? Alright, just keep your hands still. Good. Yes, you can just say pointer, middle finger, ring finger, pinky, or thumb. Okay. Good. 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 Mm-hmm. Good. 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 Okay. Now I'm going to press 2 fingers at once. Can you tell me which 2 fingers I'm pressing? And now? Good. And now? Good. And now? Good. And now? Good. Can you flip your hands over? Just tell me when you feel me touch your palm, okay? Yes. Good. 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 Perfect. flip your hands over so that your palms are up again. I'm just going to take one more good look with my lights. Just to make sure. So, after this exam, especially in all this movement, you're not experiencing any joint pain or anything. Okay. And I don't believe I got your family history, but do you have anyone in your family who has arthritis or any joint conditions or anything? Okay, that's good. Veins look normal. Okay. If you would like to take a look at some of the all-natural products that we sell out front in the shop, you can do so. Yeah, we have some really nice hand creams that you might like, especially for this cold time of year. Yes. Okay, I think I'm happy with that. Do you have any concerns or questions for me? No, I think the way that your fingers are kind of bent, that's totally normal. As long as you don't experience any pain doing day-to-day tasks like writing, anything like that, when you're holding a tool or a utensil. Just feel your wrists for a moment. But no, that doesn't concern me. I see that quite a lot. Can you just hold your hands out like this? I just want to check the symmetry. Because yes, you do have one pinky that's a little wonky, but again, that's totally normal. And based on the measurements that I took, it all looks fine. Okay, good. Well, you can finally relax your hands. So, if you don't have any other questions or concerns, I think we are all set today with your hand exam. Alright, sure. Yes, I can definitely recommend the eucalyptus hand cream. That one's my favorite if you want to check it out.